gentlemen. Now we'll have the presentations of the countries on for the countries in Latin America and Caribbean. First, we'll have the presentation from Argentina that will be done by Veronica Rison. With the floor, Ms. Veronica.
Muchas gracias, buenos días. En principio, saludo a todos los países y agradezco especialmente.
Thank you. Greetings to all countries. Thank you for Brazil for the organization of this important organization, for the countries to continue the work. I'm sharing my screen. You can read here. Can you see it? Well, thank you. Let's start due to issues of time, that there be a review. Dietary Guidelines. And one of the terms of biological, it's important to mention that we have very similar data to what was mentioned, that were mentioned by Israel. And in terms of the malnutrition in Argentina, especially in terms of obesity, and it's important that the rates that increases significantly with people with less resources and kids of 5 to 17 years. Malnutrition is more associated to obesity, and it was present in 4 in each of 10 kids. On its part, they have moderate and low rates, in some places as well with lower income. In terms of adults, as we know in the region, the rate of obesity is growing more than overweight rates, and concerns us more in terms of the NCDs, and now people from both genders are overweight. And if we see what's been happening the last year, that between 2005 2018, obesity increased 74%. But going beyond, something that concerns us is the issue of food quality in our countries. The consumption of ultra-processed product increased in 53% in Argentina. It's almost the same data we see in the regional level. And it's 53% of the energy consumed by people in the region. And we see people that are eating worse, but we showed a comparison through economic levels that people with lower income consume less fresh food, especially fruits, vegetables, milk products, but they consume a greater quantity of ultra-processed products, specifically sugary beverages, sweets, snacks. They consume those with lower income compared to those of higher income. There's a microphone open, interfering. This is also of concern if comparing as regard ultra-processed foods. What we see that kids and teenagers are eating worse than adults if comparing the quantity of ultra-processed, and what we've been seeing, way more consumption, double the number of sugary beverages, snacks, and other fried products. So in the country as a whole, there is a lot, and a lot of these has to be done as regard this. So let's continue. On the right is our current dietary guidelines, counting that until the moment, to doing a little bit of history, we've had two updates in these guidelines. The first was published 2000 in Argentina, and the coordination of the process from the Nutritionists Association, and that was taken on by the state. And in the year 2012, there was this process of updating, and they put the model developed in Latin America, and then FAO as well for the region. And we created our dietary guidelines for the Argentinian population. And the updating of these guidelines were published in 2016 and were coordinated by the Ministry of Health in terms of promotion of health and reducing non-communicable diseases with the Association of Nutritionists and with an interdisciplinary panel on this theme. And in the period of planning, we called a multi-sector trainings and audiences with labels and for all provinces, health teams, social development teams, and currently we're doing in virtual way interdisciplinary teams, but we are focusing more in terms of teachers, especially in secondary education, because it seems in the schools it's very important that have a component in terms of the schools, and this is important if they are trained. And we've made a lot of training in the last years in terms of a card so that you can that the low-income population or vulnerable population can buy food. So in terms of positive, the messages in the day-to-day basis, we're talking about 10 messages that go on to all food groups, and I'd like to remark that at these moments they're not based on the level of processing, but we've taken the level and in terms of implementation. And when we do the training, we are talking about level of processing. But to us, it seems something relevant in terms of speaking about the processing of food and the moment for reviewing these food strategies, because there have been changes in the epidemiological situation in Argentina, and these changes, like we said in the beginning, in this post-COVID, we understand that people have greater consumption of ultra-processed foods, and this we need an update so that we can put it more clearly in our guidelines. On the other hand, like Dr. Montero mentioned, there has been a lot of scientific evidence on the impact of ultra-processed products on health with this NOVA classification. We want to take more strongly this focus in sustainability in our food systems. Many of these issues that I'm talking about are already set in some of the further chapters that we've written. And in terms of capacity building, we are carrying this out, but to put them directly in the dietary guidelines and in the classification of foods. And it seems very important to us of this review and update of these guidelines. We also need a more federal focus. We have a big country with different regions, different customs. And we have taken into consideration regional culinary preparations. So we also want to focus in the more federal in terms of this autochthonous food. And also, it seems important to incorporate in terms of focus in gender that is more stronger. You know that food practices are
present in our meeting back in 2018. It was one of the comments in our debate was which in the next meeting to have more time for the countries to be able to share some or well, about the status in each of the countries and a debate on ultra-processed foods that have taken place. And it's a result of debate that we've had in 2018. And it was the idea. So it's great, Veronica, to hear the experience of Argentina. And we are eager to get to know the experience of other countries. I will share now my presentation. In just a second.
Pronto. Bom, então,
There. For us to talk to the other countries, just like Argentina and just like the data Israel has brought to the region, in Brazil currently, the main cause of death are the chronic diseases, are the non-communicable diseases. And when we look at the diseases that impact in the mortality, well, we have obesity in adults that reach 25% of adults in Brazil, and 60% of the Brazilians being overweight. And another important data that help explaining a bit the scenario of non-communicable diseases, in Brazil have 8.2% of adults with diabetes and 25% with hypertension. And when we look at the Brazilian adults that have diabetes and hypertension, 73% of them are overweight. So, but we know in front of evidence that inadequate food has an important role in the determination of these diseases. In children, just similar to Argentina, we have overweight as one of the main causes of severity coming from inadequate feeding. 3 out of 10 children have overweight. In Argentina is almost 4. And we have this data in Brazil showing that 4 in each 5 children are overweight, according to data of the Food and Nutritional Surveillance. And we have 31% of adolescents being overweight. But of course, we in Brazil, we have a prevalence of anemia and A that reduced a lot until 2019. And we are observing during the pandemic the increase of malnutrition as a whole, the excess of weight and low weight in newborns and parturients. Well, in Brazil, 53% of the calories consumed by those Brazilians are minimally processed foods, and 19% of the calories are from ultra-processed foods. So a great part of what Brazilians consume is still minimally processed in natura foods and culinary ingredients, but the participation of other ultra-processed foods has been increasing. In children, we observe that as well, the prevalence of breastfeeding has been increasing in Brazil, but they are still way below the recommendations of the World Health Organization, and the consumption in children also concern us very much. We have a surveillance that takes place in the primary care, so all children that are in one of the more than 40,000 primary care units in Brazil, they have their weight and nutritional state assessed, and we have the food consumption surveillance. So we are able to identify and follow the trends annually. And 80% of the children below 2, from 5 to 8, and teenagers have consumed ultra-processed foods in the day prior. Uh, the traditional food in Brazil is rice and beans. The Brazilians still do that, although it has decreased the participation of these foods. But it has been increasing more and more the participation of the ultra processed foods into that. I believe there's someone with the microphone open. I apologize for that.
Bom, no Brasil nós temos dois guias
Well, in
alimentares.
Brazil, we have two food guides. The first is the guide of the Brazilian population that was published in 2016, 2006, I mean, and then republished 2014, and then in 2019, and tomorrow I have the opportunity of speaking a bit more about that. We have launched the food guides, the dietary guides for the children below 2 years of age, and we considered that those guides are instruments for the promotion of health, but more than that, we try to make the guides to be, well, to lead public policies throughout all sectors and the public policies of agriculture to be elaborated from this guide. This is our desire and our intention for the food guide. On the process of elaboration, well, we have an article published in the PAHO journal. It was a series of articles that came from the decade of action towards nutrition, and there we systematize a bit of the methodology used in elaboration of the guides in Brazil, and the methodology used for the elaboration of the guide in 2014 that was improved towards the elaboration of the dietary guide for children below 2 years of age. And some important pillars came from that is to base on the best scientific evidences available, a full transparency in the process of elaboration, and also the elaboration was done with the absence of conflicts of interest. So everybody who participated declared absence of conflicts of interest. So those are the three pillars that we see as important in the methodology that we have in Brazil for the elaboration of the guides, which is transparency, the absence of conflicts of interest, and the use of the best scientific evidences available. Well, the food guide takes on some principles and that reflect the debate previously carried out. One of the points is to see that food is much more than the intake of foods. The nutrients are in the foods, but upon being fed, this is not, it's not only to get nutrients. And another important point is that we recognize that an adequate and healthy food nutrition will come from a food system that is socially and environmentally sustainable. And then in the food guide of Brazilian children below 2 years of age, we were able to add some other principles. This guide recognizes all the principles adopted in this guide for the Brazilian population, but incorporates new principles highlighting the importance that the adequate and healthy food and nutrition for children is a way to strengthen the sustainable food systems. Once the feeding of these children, well, they boost the minimally processed foods. And as it has been mentioned, we adopt the NOVA classification that divide the foods according to the degree of processing that has been approached by Professor Carlos, bringing evidences with that regard, and Professor Jeffrey as well. And we have, as the larger recommendation, the golden rule that summarizes what the guide recommends, which is always to prefer in natura foods and minimally processed foods and culinary preparations instead of ultra-processed food. And this is our recommendation that we adopt since 2014, considering this nutrition standards that we have identified. And what are the standards that protect the health and what are the ones that increase the risk? That's why it is so important to have a clear message on that sense. And here we have examples that we work a lot with the population to try and demystify what healthy food means. Well, it is much simpler than it seems. In the case of Brazil, it's rice, beans, foods, eggs, a type of meat. And the dietary guide for Brazilian children, we incorporate the WHO consideration for of breastfeeding exclusively for 2 months, we inverted the message, and we focus to the continuity of the breastfeeding in starting the first 6 months. And the recommendation in the case of ultra processed foods is for children below 2 years of age. They must not receive ultra processed foods. The dietary guides, well, besides the recommendation that consider the level of processing, there are other approaches, and I highlight the dietary guide of the Brazilian population that we debate. All the act of eating and what that means and the ways to eat, as well as we have discussed how is it possible to overcome the obstacles, the main obstacles for the Brazilian population to have access to healthy food and nutrition. And many of the obstacles, they require public policies that go over the competence of the health sector. So this is the important. That's why it's important to have the multi-sectorial action to overcome such challenges. In the food guide of children, well, we highlight that there's a very extensive chapter on culinary abilities or skills, which is one of the great objectives those food guides in Brazil have, and try to restore the families, the family cooking habits. And we believe that arrival of a child is an opportunity for the whole child to be to eat more healthy. And in the book talks all the rights the mothers and families have at the moment they have a child, and also talk about how to overcome the most common situations that take place during this period of life that could impact in the lives of children. So we work with these possible obstacles. So we summarize the main recommendation in 10 steps to provide this idea of what are the food standards that may support the Brazilians to be healthier. And in case of the child below 2 years, we have 12 recommendations. And here, a great highlight on culinary skills is the non-offer of ultra-processed foods, and also the non-offer of food of sugars before 2 years of age. And briefly, talking about the strategies we've used, I believe Carlos mentioned quite well, in a very clear way, that we have a great challenge ahead. We are over 200 million inhabitants. So although our guide is from 2014, we continue with the challenge of disseminating this information and allowing this message to be appropriate to the Brazilian population, and the food guides to be used by the public managers to try and lead the policies to make all of us Brazilians to consume the recommended foods, the foods recommended in the guide. So besides the guide, we have summarized versions, both of the food guide of Brazilian population as well as the summarized version. We have versions in English and Portuguese. We have audio books of the food guide of Brazilian population as well. We developed a test, which is how are you being fed? It's a self-assessment, and at the end, there are 3 levels of recommendations generated according to the food consumption of that individual. So we don't assess only the feeding. We talk about the obstacles and how to eat. This is a way to work this theme. And there's a series of leaflets that summarize the main information to be used by the health professionals, by educational professionals as well. And we have an online platform said Health Brazil that deals with 4 themes. That is, I want to eat better, I want to exercise, and I want to have a healthy weight, and I want to stop smoking, which is a page that the Ministry of Health talks specifically to the Brazilian population. And here we have messages, articles, documentaries on this food, and allow us to divulge the food guide, the dietary guide. And we've had hosted podcasts on the theme to reach the main target. And besides that, we have short videos for the population with regards to the 2 guides. And more recently, here in the Ministry of Health of Brazil, we have an app, something that we call Connect SUS, Unified Health Services, While all Brazilian people have access to the
agora,
main
nós conseguimos inserir informações sobre alimentação
health-based
saudável e
information,
sobre as recomendações
so for vaccination now, and we're able to add information on healthy food habits in the recommendation of the guides. In this app of the Unified Health System here, there's information on the guide. Another way to make the guidance to reach the Brazilian population, besides that, we have a series of materials that uh, bring the recommendations to the school environment. So how the teachers can work in this theme, this health and nutrition, according to the age group of the child. And besides that, in Brazil, we have a public policy that distributes the books to the children that are in public schools. The ones in public schools, they receive the school books, and in the cover of that, in the or the back cover, basically, together with the Ministry of Health and the school food fund, we have messages of on how to work with this guide with this children in school age from, well, by using the Portuguese language books. Each one has a different theme to be approached in school, and this is a way to lead to take the message of this guide to the public. And we have this guide which has been validated and has a evaluation showing the proposal of a methodology on how to train the primary care professionals. Here we have a very strong primary care that we consider to be the entrance door of all Brazilians into the health system. So next, near the homes of people, there is a basic health unit, and this is a methodology on how the managers of the different places in Brazil can train these professionals that many times are family doctors or nurses and the community agents and some wider teams with the presence of nutritionists. I believe someone has their audio open. Well, besides that, we have another series of materials that we call cardioprotective food habits. Was a way to translate the Mediterranean diet to the Brazilian food. This strengthens all the Mediterranean diets, but with the Brazilian foods, considering the food guides. Besides that, we have a series of other materials to support the health professionals into the creation of groups on the STEAM and other activities. More recently, we've had invested in protocols that we call the rapid guides, rapid counseling guides for the primary care professionals. As I mentioned, is over 40,000 teams. Well, at the moment of the individual doctor visit or doctor appointment for the unified health system to identify positive markers in this dialect. This is a flow chart with the main markers with a series of recommendations that may be approached, and all of that with the objective of bringing out the professionals, not only the nutritionists, to incorporate the healthy food into their routine. Well, we have a series of courses made available online for the training of health professionals. Those are courses that over 50,000 professionals of primary care have taken in Brazil, one on the dietary guide for children and the other one on healthy food habits. And we also, just like Argentina, we use the strategy of training of professionals and managers, their participation in scientific events, and in the programs that are elaborated. I brought three of them. Well, the breastfeeding Brazil. So the unified health system has boosted that, and this is also we have also a program in schools to have different themes in schools, and the Protect, which is a recent action to foster healthier cities for the prevention of child obesity. They always have as a crucial action the implementation of these guides, and this is a way to boost the implementation of the guide locally. Besides that, we have funded recently a series of surveys and researchers to try and identify interventions that are effective and based on those food guides for people who have diabetes, hypertension, and obesity, that they allow us to have these effective strategies. And we have a series of voluntary agreements with the productive sectors towards a reduction of soy and sugar in the ultra processed foods, and have this network, which is an important space to exchange experiences with Brazil. And recently, Brazil has approved a new model of nutritional frontal nutritional labeling. And just to close, I believe we already mentioned that this food guide, when we say that with our desire is for it to lead public policies, a successful event is that the school feeding in Brazil, well, we have over 40 million children are benefited to Brazil. Well, they recently have their norms updated and has limited the offer of ultra processed foods in school, strengthening the minimally processed foods. And another highlight is that here in the Ministry of Health, we've had an internal regulation that promotes healthier environments here in the Ministry of Health. Well, we were able to put in practice the restriction to sales of ultra processed food, prioritizing in natura and minimally processed and culinary preparations. On the evaluation and monitoring, this is one of the points that we must improve. We must improve our strategies, and what we were able to assess is, well, from the food consumption, and the Ministry of Health funds a series of studies that allow us to assess how's the food consumption, which is a direct assessment of the implementation of the food guides. And I'd like to highlight really quick the results that we have, which is the household food consumption assessment, showing that there is a decrease in the participation of the natura and minimally processed foods in the Brazilian for the Brazilians. And yes, there is an increase in the consumption of ultra processed foods, but it is possible to see that 2012 to 2000 and 2002 to 2008, the increase was much larger than 2008 to 2017, showing a possible reduction in the speed of increase of all the processed foods in the country. So this is a very important data that we are evaluating. Well, and just to close, as I have mentioned, one of the biggest challenges that we have, it continues being to intensify the strategies of implementation of the policies for all the sectors and all the population of Brazil to get to know this information, to strengthen the guide to be used by nutritionists as well as other health professionals for education and assistance, and to make this dietary guide, just like the Brazilian population guide has been used as a basis to formulate policies in education, for this to lead public policies in agriculture, in assistance, in all sectors that may contribute for the Brazilian population to put this recommendation in practice. And we must strengthen, I believe there is an audio open.
We have to do the evaluation of those guidelines, be it in terms of process as well as in terms of impact on the health of the population. And I think the great challenge, which I pointed out, is that the guides be used by other sectors. With that, I finish my presentation. Thank you very much. Thank you, Dr. Gisele. And at this moment, we will have presentation by Chile, which will be done by Mrs. Andrea Zuniga. Dr. Andrea. To all, I will share my screen, and when I start my presentation, and I might have some problem with the connection. Can you see it?
¿Me escuchan?
Sí, ok.
Ah, perfecto.
Can you hear me? Okay.
Ahí está grabando. Bueno, muy buenas tardes a todos y todas nuevamente.
Good afternoon to all. My name is, I'm from the Ministry of Health of Chile. My name is Andrea Zuniga, and I will present a summary in terms of our experience with dietary guidelines. As regards as a situation in our country, we can say that the last survey, health survey, showed results in terms of a very low